Hi, good morning. This is Dr. Mark Sell of the YouTube channel Therapy for the Heart. You've often heard me mention Dr. Gerald Lucas in many of the videos that I've made here on what makes for a good psychotherapy session. So it's my pleasure to introduce you to him today in greater detail. Following this introduction, you will find several videos of Dr. Lucas entitled Interviewing Dr. Lucas. Before he became a psychoanalyst, Dr. Lucas worked as a physicist and an electronics engineer and taught philosophy and later psychology at CCNY and then at Columbia University. He has a doctor in philosophy of science from Columbia. During his studies at the National Psychological Association for Psychoanalysis, he met Dr. Spotnitz. That meeting, I think he would say, also profoundly changed the direction of his life. Recommended by Dr. Spotnitz, Dr. Lucas became a student at the Center for Modern Psychoanalytic Studies and became a faculty member. In order to gain credits, he was encouraged to do this. He taught every course that he still needed for certification. Dr. Lucas was in the first graduating class at CMPS. He also taught and supervised at the Philadelphia School of Psychoanalysis, I think right after graduation, soon after that. The executive director of this institute, Dr. Stephen Day Ellis, once studied with Dr. Lucas. You can see a video of a presentation that Dr. Ellis made on the CMPS website where he talked about training students and staff to effectively use modern psychoanalytic interventions with a population that would have been written off by many professionals as not suitable for psychoanalytic treatment. Watch the tape, it's really interesting. I think Dr. Ellis would agree that Dr. Lucas had a profound impact on his understanding of modern psychoanalysis. In 1979, Dr. Lucas went on to form his own institute with the help of his wife, Dr. Marie Lucas, also a graduate of CMPS. It was called the Institute for Modern Psychoanalysis, IMP, or affectionately referred to as IMP. Marie had much to do with being the administrative backbone of IMP. She was responsible for obtaining their beautiful residence, which also became the home of IMP. Marie helped me personally through a very difficult time in her life, so I'm forever grateful to her for doing that. Like Dr. Ellis, Marie had a special interest in an underserved population as far as psychoanalysis. People released from prison and on probation. For years, she worked effectively with this population. By the way, when I say psychoanalysis, I refer to the third talk where I differentiate psychoanalysis, classical psychoanalysis from modern psychoanalysis. IMP lasted into 2004, about 25 years. Then with licensing in psychoanalysis, there came more bureaucratic controls. So at that time, almost all the students had graduated from IMP. So Dr. Lucas ended IMP and started STEP, the School for Effective Training in Psychoanalysis. It has the same home as IMP, 112 West 87th Street. The training program at IMP. From 12 to 18 students met with Dr. Lucas on Saturday mornings for approximately 10 weeks each semester for 3 hours a week. Many people who became acquainted with Dr. Lucas through contacts in Philadelphia made the trip every Saturday to attend classes at IMP. I was not a matriculated student at IMP because I already had a certificate in psychoanalysis from IPTAR, but I regularly attended these meetings from about 1995 on, faithfully every Saturday. The training consisted of studying the work of Dr. Hyman Spotnitz. We would go through his book, Modern Psychoanalysis of the Schizophrenic Patient, chapter by chapter by chapter. That was followed by the Transference Resistance Group and finished with an hour of supervision. A Transference Resistance Group, what is that? I mention it in my talks. I run one right now modeled after Dr. Lucas. Dr. Lucas often stressed the importance of developing the courage to say everything, because without that ability, it is difficult to help our patients say everything. So how can we become competent and courageous if we don't how can they become competent and courageous to say everything if we don't? So people in the room express their fugitive thoughts as much as possible. What was once fugitive became more integrated into one's consciousness, permitting each participant to have more awareness of their transference and countertransference reactions. By speaking freely, this is all about free speak, saying everything, one becomes a more integrated person and a more competent analyst. And this is difficult in a group, especially if the group is composed of psychoanalysts, social workers, whatever helping profession might be in that group at that time with Dr. Lucas, because, you know, often we have to think we have to be above it all in terms of problems, and it's more difficult, but it's the most rewarding and a growth experience that one can have, to be able to work through the shame of saying things that are on one's mind and get the courage to do that. Dr. Lucas learned to become emotionally spontaneous in training groups with Dr. Spotnitz, training group sessions with Dr. Spotnitz. Dr. Lucas is fearless, as was Spotnitz, so he could handle aggression from group members without retaliation. This was a quality he admired in Dr. Spotnitz. Although the director of IMP, Dr. Lucas would never use his position to intimidate group members in that group. You could say anything you wanted to Dr. Lucas, and he would really help you release whatever negative interjects were in you, get them out into the external world, which is really what modern analysis is all about, which helps people become healthier and less self-condemning and attacking. So it is with great pleasure to introduce you to this special playlist of videos interviewing Dr. Gerald Lucas. If you have a YouTube channel, it's easy to make one if you have a Gmail account. You can then comment and write in and say hello to Dr. Lucas if you'd like to do that. If not, you can always access these videos by entering Mark Sell on YouTube, and you'll come up with the videos. Or you could write to him, to Dr. Lucas. I'll give you an email address on this video here. Please like this channel by pressing the like button. And a final note, this month is the 1-year anniversary of the channel Therapy for the Heart, and within that year we've received about, we meaning myself, received about 46,000 views, which I'm very proud of. So I'm going to sign off right now, and I want to thank you again for listening, and I will be back shortly with some new videos on what makes for a good therapy session. Thanks a lot. Signing off, Mark Sell.